Today we're gonna start a very important topic, another which is actually also associated with the gingival overgrowth, and this is systematic conditions. That's how in systematic conditions the gingival overgrowth can occur. So basically, let's start it. Bismillahirrahmanirrahim. So basic changes in systematic conditions that can lead to also gingival growth. Basically, the cause and clinical features of gingival overgrowth that can be associated with the systematic conditions are basically different, diverse, and manifest with the amplification mean increase of existing inflammation due to also bacterial inflammation. Okay, this is called condition enlargements. Then there are specific conditions in which the enlargements can occur, like their hormonal changes, nutritional ethologic factors can occur. This in gingival inflammation can also be due to microbial factor, which is actually leading cause that hormonal and nutrition changes it modifies basically. And some researchers also say that these lesions as gingivitis can be also associated pathologies. However, in pregnancy and puberty it has been established as causes of hormonal changes and nutrition factors, and histologically can include vitamin C deficiency, and otherwise allergic reactions can also be linked it. So basically the women and with the women that are pregnant, so basically their clinical manifestations with gingival overgrowth is a common pathology. It is a very common in those women that are pregnant. Clinically, how it present, it will be a single mass or multiple tumor like masses in the gingival margins. Okay, so basically there will be masses or multiple masses that can be present on the gingival margins. So basically it can be a single mass like this on the gingiva, or either it can be multiple tumors like masses on the gingiva. Okay. Now there is marginal gingival enlargement that can during pregnancy can also aggravate of previous inflammation, and the incidence is 10 to 17%. Okay, so they are considered pregnancy tumors, but but these tumors are not actually neoplasms. It is actually an inflammatory response due to accumulation of plaque that is actually modified by patient's condition. Okay, and it appears in the third month of pregnancy. Okay, the reported incidence is 1.8% to 5%. Okay, then basically enlargement is can be generalized and can be also localized. Okay, don't forget it is more prominent intraproximally on the facial and lingual basically surfaces. The enlarged gingiva is how it represents. It is red, magneta, soft, febrile, soft, shiny surface, shiny and smooth because it is inflammation. Bleeding can occur on this due to slight provocation. They are discrete and mushroom-like flattened spherical masses that can be protruded from the gingival margins and even often from the interproximal spaces. It can be pedunculated and sessile also. Okay, and the cheek can perpetuate its flattened appearance. It is also dusky red and glatining surface. It shows numerous deep red pinpoint markings. Okay, but it does not aware the underlying connective tissue. Okay, in early, it can be painless, but due to debris accumulation and interface with occlusion, it can be a painful ulceration. Now, although the microscopic findings were characteristics of gingival enlargement during pregnancy, they are not pathogenic. Okay, so don't consider it can be pathogenic. It is actually normal during pregnancy. This gingival enlargements actually occur. Now they are saying that pyogenic granuloma is very similar to the gingival enlargement that during pregnancy can occur. So this lesion manifests as a tumor-like gingival enlargement that is actually condition exaggerated response to a minor trauma either. But the exact nature of systematic conditioning factor that has not been identified, and the differential diagnosis is actually based on the patient's history, how it basically caused. So we all know there are hormonal changes during pregnancy. So progesterone level and estrogen levels become increased 10 to 30 times more during the end of the trimester as compared to menstrual cycle. So it plays a very um, important role in this. So the hormonal changes basically there are present, but basically there is no actually research that how these hormonal changes actually cause this inflammation. They are also saying that due to hormonal changes they induce an increased vascular permeability that leads to the gingival edema and increased inflammation to response to dental plaque. There is impaired vascular response and inflammatory that can lead to modification of subgingival microbiota, but there are no specific bacteria that in this condition can increase. Okay, it means although not specific that there will be increase in Provatella intermedia or either Provatella melan, melanogenica.